Okay, we're here with Mr. Haney at Euclid Chiropractic. We want to discuss is really what he's done the last few years as a patient here and also through outside seminars to change his lifestyle. Go ahead.
Well, I was diagnosed as a diabetic, and so I immediately had to change my lifestyle if I wanted to live. The results of abusing yourself are terrible and awful. You go through things like having eyesight problems and having circulation problems and just all kinds of problems.
So side effects of being diabetic.
Right.
Okay. Type 2 diabetes, correct?
Type 2 diabetes.
Okay.
And so went to some workshops that Kaiser put on and started changing my lifestyle. And I had to do it cold turkey. I stopped drinking any kind of sugary drinks. I thought that drinking fruit juices was really good for you. Not good for you. They have a lot of sugar in them, and so I stopped drinking all fruit juices, no Cokes, no soft drinks, and stopped eating hamburgers, and stopped eating all desserts. Anything with sugar in it, I just stopped. And just did it cold turkey, just stopped overnight.
Wow.
Amazing what the difference was. I dropped 45 pounds just so quickly and started walking a lot more because exercise is an important part of staying healthy.
Well, and with that too, exercise and nutrition, what else have you done in the process to keep your body overall healthy too? What portion has chiropractic been in that realm?
Oh, well, I've been going to a chiropractor for a long time, but I was developing back pain, and along with eating right and taking care of myself, I started having back massages and just really straightened out the pain. And I've been going to a chiropractor twice a week for several years now.
Okay. Okay. And when you mention, say for example, fruit juices for 1, 2, what do you do when you go shopping, you had mentioned earlier, to make sure you're eating the right type amount of foods?
Well, I've learned how to read labels.
Okay.
And so when we go shopping, we look at the sugar content of what we're eating, and we look at the kind of fat that is in it, and we just are very, very careful that we buy whole wheat things, never anything that has been starched. We have to eat some starch, but we don't eat things like white bread and white rice. We always eat brown rice and brown bread and whole wheat.
Well, and talking to someone, for example, if you're talking to a friend of yours and going, hey, I've done this, why don't you try this? What's the biggest drawback that you see with people not wanting to go this route?
You know, it's a very, very good question. I've been talking with my own kids. And
family's the best, right? They're the ones that you
sure.
hard to get to.
Yeah, my daughter keeps saying that she needs to lose weight. She does. And yet, when we go out to eat, she eats the same thing she always has eaten. Well, yeah, that doesn't work.
So what has to happen in her mindset first before her body will lose weight?
She has to get serious.
Yeah.
And the whole idea of staying healthy is an idea of being serious about it. It means you have to get informed. It means you have to read. You have to know what things are doing to your body.
Is it better to wait till you, like for example, I'm being sarcastic, to get diabetes and then do it, or do it actually when you're in a healthy state?
It's so much better to do it before you get sick.
Okay.
But I have been able to reverse the whole problem that I had. My blood sugar's always low now.
Do you ever go on medication for your diabetes?
I'm taking metformin.
Okay.
But the doctor, the last time I talked to her, said, you can stop that if you want to. You're under control.
What is your viewpoint on medications?
I don't like medications. In fact, I take just as little bit of them as I possibly ever can.
Okay.
I don't ever take aspirin or headache stuff, or I don't ever take anything for pain. Fortunately, I don't have a lot of pain, but
Okay.
but I did have in my back. I had a lot of pain.
Well, that's my thing. Sometimes people get so far along in a disease, maybe diabetes or something related to their overall health, to where it's too far sometimes to turn back.
Oh, absolutely.
So I think it's almost better to do it when they're more serious about it, when they're actually feeling healthy.
Yeah, you have to be serious about your health.
Yeah. Okay.
You can't just pretend, and your body isn't fooled.
No.
I'm going to have a little bit of dessert this time.
Well, thank you, Mr. Haney. Thanks for your interview. It's really just
welcome.
getting people to understand why, and in your sense, an example of how to get healthy.
Thank you.
Welcome.